ABC 7 News starts right now.
Well, a new way to fight fat. Next on ABC 7 News, the no surgery solution to those unsightly saddlebags. That's a special report from Amma tonight.
For many women, even diet and exercise aren't enough to trim certain problem areas. And while liposuction has been an option for years, some are now turning to a new, less invasive method, freezing the fat away.
Rowing on the Bay Area's waterways can burn plenty of calories, but for Lieghann Spivey, it hasn't been enough to tighten up her one problem area.
My legs have always been a point of contention for me. No matter how much I exercise or how much diet, they never shape the way that I want them to shape. So specifically what I call the saddlebags.
To smooth some of the hip area, Lieghann turned to Dr. Zeidler and a new but increasingly versatile technology. It's a method called Coolsculpting, designed to freeze away fat.
Coolsculpt, I think, is really new and innovative and really has a track record of demonstrating really good results.
2 years ago, we profiled the original version of Coolsculpting, which employed a single small housing designed mainly for love handles around the waist area. The strategy was the same, killing fat cells with cold and letting the body's endocrine system wash them away. But recently, the manufacturer, Zeidler, developed a redesigned applicator that can target the hip and thigh areas.
Instead, it's one flat plate. It's curved a little bit to fit the contour of the thigh. The treatment is slightly longer, 2 hours instead of 1 hour.
To make the best use of that time, applicators are placed on both thighs at once. The system slowly decreases the temperature without burning the skin. Still, she says patients should know that the effects are not as immediate as competing treatments such as liposuction. These before and after pictures provided by Zeidler show results that are most often achieved with multiple treatments spanning several months. Still, she says the non-surgical nature of the treatment is a draw for many patients.
These patients can walk out of here, they'll have a little bit of numbness and tingly feeling on the thighs, but they can work out. They can go to work the next day.
Lieghann is hoping to see about a 25% reduction over the first 2 months and plans to have a second treatment after that. Her ultimate goal?
Pencil skirts. I love pencil skirts, and I always feel like I have saddlebags, that side bulge that to me is just not that attractive.
A single treatment on both thighs runs about $1,500 and is rarely covered by insurance, though the costs are typically less than comparable liposuction procedures.